So let's go back and review some physiology and review our respiratory center and how they work, because that will help us when we talk about the desynchrony of the ventilator. Um, as you all know probably that the main respiratory center are in the medulla oblongata. We have the dorsal respiratory group and the ventral respiratory group. Also, there is two centers in the pons that help regulate this as well, but I'm gonna just focus on the one in the medulla oblongata. The dorsal respiratory group sends signals to the diaphragm and external intercostal muscles and to contract and start inspiration. And when this ceases, these muscles relax and expiration start. This dorsal respiratory group maintain our normal breathing rhythm. The ventral respiratory group, on the other hand, they send signals to the accessory respiratory muscles and internal intercostal muscles, and they are involved in forced inspiration and expiration. It's very important to know, probably, I guess you know that we have central chemoreceptors in our brain and peripheral chemoreceptors located in the carotid and the aortic arteries. And the goal or the function of these receptors is to regulate our breathing, to send signals back to the dorsal respiratory group to regulate our breathing. Let me talk quickly here before we come to the pulmonary stretch receptors that, believe it or not, the most important factor in regulating our breathing is CO2 level in the blood and hydrogen ions. And as you know, they go hand in hand, these two. When CO2 goes higher, hydrogen goes higher, and the body gets acidotic. So what happens is when carbon dioxide goes higher, it's easily and readily, it's easily can cross the blood-brain barrier and sensed by our central chemoreceptors that there is high CO2, the hydrogen ions will be higher and the pH will drop, right? As all of you know this will be sensed, and the signals will come from the central chemoreceptors to the dorsal respiratory group that will start firing more frequently for the patient or for us to breathe faster and wash out CO2. And the opposite is true. So this is the main factors, is the CO2. The hydrogen ions as well, if the patient is acidotic, let's say from lactic acidosis, this will be sensed by peripheral chemoreceptors. And the same procedure, this will be sent to the brain and dorsal respiratory group, and they will start breathing faster. Kind of an air hunger. I want to breathe faster to wash CO2 to compensate for the metabolic acidosis. The oxygen role is much less in regulating our breathing, but it does affect that when our dissolved oxygen becomes extremely low, this will be sensed by our respiratory centers and will start breathing faster. But remember, the respiratory center or chemoreceptors respond to the dissolved oxygen, not to the bound to hemoglobin. So when the dissolved goes low, the bound one will release more O2, dissolved O2. So it needs the bound, the oxygen, the bound to hemoglobin level to drop significantly to trigger these chemoreceptors. And that's why the main gas that regulates our breathing is CO2, and the hydrogen ions, the main electrolytes, which is acidosis and alkalosis. The pulmonary stretch receptors are receptors located in our respiratory system to prevent hyperinflation. So basically, if there is excessive stretching of the lungs, that will send these receptors and signals to the dorsal respiratory group to reduce respiratory rate, or actually to terminate inspiration and go to expiration. So this is an important thing I want you to know, because will come when we give a very high flow rate, how that may create some dysynchrony. This is a quick wrap up. I recommend you go back, and if you want more details, to go to the physiology of our pulmonary system and physiology books.